Hi, my name is Colin Dentel-Post, and I'm a senior transportation planner at the San Francisco County Transportation Authority. Today, I'm going to share some information about our downtown congestion pricing study that we're currently working on, and hopefully provide some education on congestion pricing and an opportunity for you to provide feedback. So to get started here, we have to acknowledge that coronavirus has really changed our daily lives and that we're all just trying to keep ourselves and our families healthy. And that in that context, there's not a lot of congestion on our streets today. So what does that mean for a downtown congestion pricing study? We don't really know what our post-pandemic future will look like, but we can, based on past experience, project that we're likely to see a return of economic growth to San Francisco because we've proven to be resilient in the past. And we're anticipating that congestion is likely to return when economic growth does. So the work we do now can help us plan and prepare for the recovery so that we don't repeat the problems we saw when congestion was at peak levels. And now is an important time to think about what kind of future we want to create after the pandemic. This image shows congestion in 2019 when it had reached record levels. And as you can see from the orange and red in the map, it was concentrated on streets in the downtown and northeast part of the city, which is also the core of our city's transit system. So transit is really getting impacted as well. There were several main reasons why people were driving more than ever in 2019, and for the increase in congestion we saw between 2010 and 2019. About half of that increase was because of growth in both our city's population and an increasing number of jobs. And it is as is typical when people are traveling more, people were making more trips and many more of them were driving. The other half of the increased congestion between 2010 and 2019 was because of demand for travel by ride-hail vehicles like Uber and Lyft, which further increased the number of trips on our streets. Congestion affects everyone in different ways. Too many cars on the road delay people who are trying to get home, to work, to medical appointments. They also pollute the air, and all of these car trips can increase the frequency of crashes. The air pollution, noise, and safety concerns especially impact health and quality of life in our most congested neighborhoods. You can also be affected if you're on a bus because traffic delays your trip, sometimes even if you're in a bus-only lane. So that's a big part of why transit bus speeds downtown were just 6 miles per hour when congestion was at its peak. You, of course, can also be affected by congestion if you're driving. And people driving were spending almost 100 hours a year in the Bay Area stuck in traffic in 2019. If you're walking, it means you can be dealing with blocked crosswalks, and maybe more importantly, you're more likely to be injured when there are more cars on the road. So it's a safety issue as well. And that same is true if you're biking. You're also more likely to be injured if there are more cars on the road. If you're living or working downtown, then more cars on the road mean you're breathing more air pollution and more of the unhealthy impacts of that pollution. And vehicles cause most of our region's air pollution, and it's especially concentrated near our busiest streets and freeways. If you are a business, then you're more likely to have to wait longer for delayed deliveries and potentially pay more for those deliveries because they're delayed in congestion. But maybe most importantly, too many cars on the road are disproportionately affect low-income communities and communities of color. And these disadvantaged communities pay the highest costs for the situation because people are most likely to be riding the bus, which is stuck in traffic and even slower than driving, and living in areas with higher rates of traffic collisions, also living in areas with the most polluted air, so experiencing health impacts like asthma at greater rates, and spending a disproportionate amount of their income on transportation, especially for low-income folks who need to drive. So this map shows the overlap of, in purple, the areas that are concentrations of low-income communities of color in San Francisco, and in orange, the streets with the highest concentration of traffic injuries and fatalities. And you can see how much overlap there is. There are a number of things that the city tried to do to address the congestion issue, including having more officers and parking control staff at key intersections to direct traffic, pricing on-street parking to try to reduce the number of people circling around looking for a space, making sure that a few spaces are always available, and encouraging more efficient travel through things like transit-only lanes, bike lanes, and taxing ride-hail trips to provide more improvements to transit, walking, and biking. So really trying to get people into more sustainable and more space-efficient ways of getting around. But unfortunately, all of these efforts weren't enough to address the congestion that we saw in our economic peak. And so we really just can't build our way out of this problem, and there's too much demand for driving and not enough road space to accommodate all of the cars. So what you can see in this photo is there's actually a bus lane, and it's blocked by all of these cars that are trying to turn right. So there are just too many cars trying to turn and trying to get around our limited streets, and it's preventing our transit improvements from working as well as they should. So when our economy rebounds, we'll need to reduce the number of cars downtown to make walking, biking, and transit improvements work. As we think about how to create a better transportation system post-pandemic, let's keep in mind strategies to get people to shift from cars to more space-efficient and sustainable ways of getting around. And so that's where the idea of incentives can come in. And so the downtown congestion pricing study is exploring this idea called congestion pricing, which is charging a fee to drive downtown during busy hours, which could keep traffic moving. And implementing congestion pricing when traffic returns would reduce the number of cars driving downtown at peak times, and is one of the most effective tools we can use to manage congestion. It's actually already been implemented in a number of cities around the world, and New York is the first US city to have approved a congestion pricing program. For example, in London, they implemented a congestion pricing program in 2003 that went along with lots of increased transit service and saw significant benefits in terms of traffic congestion going down, increasing transit ridership, and reducing greenhouse gas emissions. They actually also suspended charging at the beginning of the pandemic since congestion disappeared and they were trying to help essential workers get around. So these programs can be flexible and respond to conditions as they happen. Similar benefits happened in Stockholm after its congestion pricing program launched as a pilot in 2006. And what's interesting in particular about Stockholm is that the program was initially a pilot. When it was implemented, 2/3 of residents opposed the policy. But after seeing how it worked once the program was implemented, residents actually voted in favor of making the program permanent. And it subsequently started enjoying much higher approval rates. So in San Francisco, we have actually studied the idea of congestion pricing once before. In 2010, our study found that there could be significant benefits of a congestion pricing program in Northeast San Francisco, and that a reduction of 12% fewer peak period auto trips could result in significant reductions in vehicle delay and improvements in transit speeds. It would also have benefits in terms of greenhouse gas reductions and reduced collisions. And meanwhile, the business effects the study found would be generally neutral. So as a result of those findings, the congestion pricing idea has been included in a number of different plans and policies of the city, including our climate action strategy and our Vision Zero action strategy. So that brings us to when congestion was back at our peak and how we got where we are today, which is our board, which is also the Board of Supervisors, directed us to explore how a congestion pricing program could work for San Francisco and whether it could be equitable and effective. So we started by looking at some data on congestion and who is driving in San Francisco. And what we found is that about 3/4 of people driving into and out of the downtown area are coming from within San Francisco itself. The other 25% are coming from around the region, particularly the East Bay and South Bay. We also looked at breakdowns of travel by income. And what you can see here is people in the higher income groups are much more likely to be driving, while people in the lower income groups in these higher bars are much more likely to be taking transit, walking, or biking. And in fact, only 13% of all trips in the morning peak period are people in the lowest income category who are driving. So it's a relatively small number of people that we'd be really concerned about making sure we are protecting in a congestion pricing program. So that brings us to how we might develop a congestion pricing program that works in San Francisco. And in terms of the kind of existing normal, when congestion was at its worst, we saw lots of people stuck on buses and in traffic, cars blocking the crosswalk downtown. And as we're looking forward towards what a future with congestion pricing could look like, there could be a fee that is charged to some folks who are driving downtown in order to unclog the streets. And some of those people would decide to pay the fee, while others might decide to drive at a different time, a little bit off peak if their trip is flexible, or maybe travel by a different mode, like getting on the bus. Everyone else, while driving or riding transit, would have a smoother ride, and certain groups, like people with disabilities or people who are lower income, could receive an exemption or a discount. Meanwhile, fees from the program could be reinvested in safer streets and better and more transit service, for example. So in order to make a lot of the changes that we would want to see, we expect we would need to reduce the number of peak car trips downtown by at least 15% from 2019 levels. So that's the target for a congestion pricing program. And we expect that that would allow us to meet 4 key goals for our potential program. And those are, number 1, to get traffic moving, number 2, to increase safety, number 3, clean the air, and number 4, to advance equity. So going through each of those, what get traffic moving means is getting people and goods where they need to go. And specifically, we're talking about reducing the amount of delay that people experience and speeding up buses. The second goal is increasing safety for people, whether they're walking, biking, or driving, with the goal of reducing the number of crashes and injuries in the downtown area. In terms of cleaning the air, we're talking about supporting public health and fighting climate change. So that means both reducing unhealthy air pollution and reducing our greenhouse gas emissions. And fourth, our goal is to advance equity, and that means prioritizing public transit and making it easier for vulnerable communities to get downtown. We'd be prioritizing travel safety and clean air improvements for people who need them most, and prioritizing program discounts and revenue for those disadvantaged populations. So here's our study schedule that we've been working under, and all of these steps involve conducting lots of community outreach with the goal, along with analysis, to narrow down to a final recommendation to share with our board. And once we share a recommendation with the Transportation Authority Board, again, also the Board of Supervisors, there'd be a number of steps if they decide to direct us to move forward. And those would include needing to develop detailed policy and system designs, pursuing state legislation that we would need to authorize a program. And all of that would involve a lot of community outreach to really work out a lot of the details before a program could be implemented. So community outreach and input will be critical to helping guide how we develop specific program ideas to best meet these study goals we've talked about today. And so we're presenting to community groups throughout the study process, and we welcome certainly any questions or feedback you have now. And you can email us at the address on the screen, which is congestion-pricing@sscta.org. And also, we welcome you to visit our website where you can sign up for our email list. It's the best way to make sure you stay involved as we go forward. You can make sure to learn about how congestion pricing could work, as well as we'll let you know about future upcoming activities that you can participate in. And that'll give you the best opportunity as we go forward to make sure you're providing feedback. And we're getting that feedback throughout as we go forward and our study progresses. So thank you very much, and we hope to hear from you soon.